Hi, my name is Eglė, and I'm a final year PhD student and mental health research case scholar at Cardiff University, Division of Psychological Medicine and Clinical Neuroscience. My research aims to identify protective factors for mental health resilience in offspring of depressed parents, since we know that they are 3 to 4 times more likely to develop depression and other mental health conditions. My PhD journey started with the involvement of a youth advisory group where we aimed to define mental health resilience and identify the most effective protective factors for sustaining good mental health. Young people emphasized that resilience should be perceived as an ongoing process rather than an outcome and suggested that focusing on individual lifestyle and social factors would be the most helpful approach. Then I conducted a systematic literature review that summarized 60 studies and identified more than 70 protective factors. Among those, the quality of the parent-child relationship, parental positivity, and co-parent support were the most strongly supported, although most of these studies examine protective effects in childhood and adolescence rather than in adulthood. Therefore, I decided to examine if these family, individual, and social factors identified as protective earlier on would be still relevant in young adulthood. In my first study, many protective factors such as positive family relationships that were associated with resilience in adolescence did not have long-lasting effects in young adulthood, which implies that building resilience is an ongoing process. Then, as suggested by the Youth Advisory Group, we examined if maintaining a healthy lifestyle during adolescence, such as eating healthy, exercising, or having good sleep habits, could lead to lasting improvements in depressive symptoms. We also explored if these healthy lifestyles would be particularly beneficial for those who were raised by a depressed parent. We found that healthy habits such as consuming enough folate and tryptophan, engaging in physical activity, getting adequate sleep, and having good sleep habits decrease the likelihood of depressive symptoms between ages 17 and 25. On the other hand, spending too much time sitting, going to bed late on weekdays, sleeping in on weekends, and trying to make up for lost sleep increase the risk of feeling depressed. And these effects were not limited to individuals with a family history of depression. So, our study supports previous research by showing that physical activity has positive effects on mental health. And unlike other studies that mainly focused on short-term effects, we found that the benefits of physical activity are long-lasting, since adolescents who engaged in physical activity had fewer depressive symptoms a decade later. Research implies that engaging in physical activity can play a significant role in the prevention and management of mental health problems. So, as we approach Mental Health Awareness Week, it's crucial to prioritize our well-being and make time for movement. Whether it's cycling to work once a week or opting for a 10-minute walk home by parking our car further, these small actions can have a positive impact on our mental health. So, let's try to move more for our mental health.